blood pressure in the setting of acute ischemic stroke. It goes for period of time. For years, the guidelines are conflicting. Some people advise to lower the blood pressure. Some of them advise not to lower the blood pressure. Till 2015, 2015, we have a guideline set by the Canadian guidelines. They stated clearly blood pressure equal to more than 220 over 120 can be reduced. But at that time, still the Europeans and the American guidelines, they didn't set up a number of the systolic or diastolic blood pressure to be reduced. Because the concept at that time, people think of in the acute ischemic stroke, the cerebral perfusion pressure is reduced because of, by a way of another, there is some sort of increase in intracranial pressure. So to maintain the cerebral perfusion pressure, the body adapt by increasing the blood pressure to increase the MAP. Because as we know that CPP equal MAP minus ICP. Cerebral perfusion pressure equal mean arterial pressure minus intracranial pressure. So it is a compensatory mechanism. So people at that time thought that probably high blood pressure is beneficial to the patient because it maintains cerebral perfusion pressure. Why? So as not to damage the number. As we know that in the acute ischemic stroke, there are some neurons are infarcted, but there is a zone of neurons that surround this infarction. These cells are viable but ischemic, and this is what we call number. So reduction of the blood pressure in this setting may damage the number. And there are other things, not only the blood pressure, that may damage the number. People should take care not to use in the management of acute ischemic stroke, namely IV dextrose. And it has been found that IV dextrose is one of the things that will damage the number. And also hypothermia and hyperthermia. Both high temperature and low temperature, these are the things that may damage the number. So please avoid prescribing IV dextrose to patients with ischemic stroke without indication. Only if the patient has hypoglycemia that cannot be corrected by oral route. And in 2015, the Canadian set 220 over 120. Above this number, you can reduce the blood pressure. Below this number, there is no benefit to reduce the blood pressure. The Americans and the Europeans advise to reduce the blood pressure at above this level, but they concluded that there is no evidence if you do not reduce the blood pressure, there is a harm to the patient.